Welcome to this video where we'll explore a common, yet often misunderstood, eye condition called marginal keratitis. We'll delve into its causes, symptoms, diagnosis, and treatment, providing you with a comprehensive understanding of this inflammatory corneal issue. If you've ever experienced persistent redness, discomfort, or vision changes, this video is for you. So, what exactly causes marginal keratitis? The primary culprit is often a hypersensitivity reaction to bacterial toxins, particularly those produced by staphylococcal bacteria, commonly found on the skin and eyelids. Think of it as your eye overacting to the presence of these bacteria, even if the bacteria are not directly invading the cornea itself. Other potential contributing factors include blepharitis, which is inflammation of the eyelids, and dry eye syndrome, as both can compromise the eye's natural defenses against bacteria. Now let's talk about pathophysiology, or how the disease develops. The bacterial toxins trigger an inflammatory response in the cornea. This inflammation manifests as infiltrates, collections of immune cells near the limbus, which is the border between the cornea and the sclera, the white part of the eye. These infiltrates typically don't involve an active infection of the cornea itself, unlike other types of keratitis. Instead, it's the immune system's reaction to the toxins that causes the corneal damage and subsequent symptoms. Marginal keratitis is a relatively common condition, and while it can affect individuals of any age, it's more frequently seen in adults, particularly those with pre-existing conditions like blepharitis or dry eye. There isn't a strong gender predisposition, and it affects people across various ethnic backgrounds. The exact prevalence is difficult to pinpoint, as many mild cases might go undiagnosed or simply managed with over-the-counter remedies. The signs and symptoms of marginal keratitis can vary in severity. Common symptoms include redness, usually localized to the edge of the cornea, along with a gritty or foreign body sensation in the eye. Patients may experience tearing, photophobia, which is sensitivity to light, and mild blurred vision. It's crucial to note that pain is typically mild to moderate, distinguishing it from more severe corneal infections or ulcers. Diagnosing marginal keratitis typically involves a thorough eye examination by an ophthalmologist or optometrist. The key diagnostic feature is the presence of characteristic corneal infiltrates located near the limbus. The doctor may use a slit lamp, a specialized microscope, to closely examine the cornea. It's also important to rule out other conditions that can cause similar symptoms, such as viral keratitis or corneal ulcers. Bacterial cultures are usually not necessary, as the condition is not typically caused by direct bacterial invasion. Marginal keratitis doesn't typically have distinct classifications or types in the same way as some other diseases. It's usually understood as a spectrum of severity, ranging from mild, self-limiting cases to more persistent or recurrent episodes. The focus is on managing the underlying contributing factors, such as blepharitis or dry eye, rather than classifying the keratitis itself. Treatment for marginal keratitis primarily focuses on managing the inflammation and addressing any underlying conditions. Artificial tears are often recommended to lubricate the eye and reduce irritation. Topical corticosteroids, in the form of eye drops, are frequently prescribed to reduce inflammation. In some cases, topical antibiotics may be used to address any associated bacterial overgrowth on the eyelids. Proper eyelid hygiene, including warm compresses and gentle lid scrubs, is also essential, especially for individuals with blepharitis. Preventing marginal keratitis involves maintaining good eye hygiene and managing any pre-existing conditions. Regular eyelid cleaning, using warm compresses and gentle scrubs, can help prevent blepharitis and reduce the bacterial load on the eyelids. Using artificial tears to combat dry eye can also help protect the cornea. If you wear contact lenses, ensure you follow proper cleaning and disinfection protocols to minimize the risk of bacterial contamination. Avoid rubbing your eyes, as this can irritate the cornea and introduce bacteria. The prognosis for marginal keratitis is generally excellent. With appropriate treatment, most individuals experience complete resolution of their symptoms within a few days to weeks. However, recurrence is possible, especially if underlying conditions like blepharitis or dry eye are not effectively managed. Research into the specific immune mechanisms involved in the hypersensitivity reaction continues, and advancements in targeted therapies may offer even more effective treatment options in the future.